I'll bet your dentist never told you that people who have gum disease have up to a 70% higher risk of dementia. Now, could it be that your toothbrush is actually protecting your brain? I'm Betty, and if you're midlife or beyond, then join me on my journey as I'm exploring natural ways that can help us to live longer and stronger lives. I never thought much about dementia until my mom started showing signs of cognitive decline after she turned 90. Before that, I always thought it was something pretty rare. But then I started hearing about it more often. Friends my age were making plans for their later years, assuming that they were going to have dementia. And I would hear comments like, "It's hereditary, it's inevitable, it's irreversible." Now this gave me the desire to dig in a little bit and try, if I could, to disprove these comments. You see, I might not be a healthcare professional, but from what I understand about the human body, it's designed to heal itself and to correct dysfunctions if we just cooperate with the way it operates. So I was a bit surprised to find this information that I'm about to share with you. It's just so basic and so simple, and it makes sense, really, because our mouth is so close to our brain. There have been studies done that have found that people who have gum disease are much more likely to have problems with their memory and even dementia. When the gums stay inflamed for a long period of time, that infection doesn't just stay in the mouth. That inflammation passes through the bloodstream and it can affect the blood vessels and even your brain tissue. There's a certain kind of bacteria that causes gum disease, and that bacteria can get into the bloodstream and travel. And researchers have found that very same bacteria in the brains of people who have had Alzheimer's disease. That means that what happens in our mouth doesn't just stay in the mouth, but it can impact the brain. And then there's the blood flow. Poor oral health is linked with vascular problems, which means that there's less blood flow reaching the brain. And less circulation can mean less oxygen and less nutrients for the brain cells. Not only that, but older adults with fewer teeth have a higher risk of memory problems. That can be partly from their nutrition, because not having enough teeth does make it harder to chew food properly and get the nutrition from it, but also because of a higher level of inflammation that they have in their body in general. So what can we do to prevent these problems? Just the things that your mom always told you to do. Make sure that you brush your teeth. Take good care of them. Keep them clean. Use dental floss. And remember to have dental checkups regularly. Don't wait until something goes wrong, until you have pain or symptoms, but get your teeth checked, get them cleaned once in a while, because it does feel so nice when they're freshly cleaned by a professional. But definitely, if you see any kinds of symptoms in your mouth, and if you have any pain in your teeth, or if your gums are bleeding, or you notice a real change in your breath, then make sure that you go see your dentist promptly. These things could be telling you something about your oral health or about your health in general, including your brain. So it's important to keep in mind that taking good care of our teeth is more than just wanting to have a pretty smile. Really, it's linked to our memory, our cognitive health, and even our independence in old age. It might seem like just a little thing, but really a toothbrush could be more powerful than a prescription when it comes to preventing cognitive decline. The subject of dementia is so important for our later years that I've got some other videos that you can take a look at. I'll put the playlist right up here. And if you want to click down there, then you can subscribe to my channel. But thanks for watching this video. And remember to stay strong, and I'll see you in the next one.